There, welcome once again to Nurse Kodia's page. I'm excited to have you here. Today, we're going to be talking about why I should get an associate's degree in nursing compared to a Bachelor of Science in Nursing. One of the reasons why these institutions are requiring that nurses who have their associates go in for their BSN is because over time, research has proven that higher education nurses have, the better patient outcomes there will be. So that's one of the reasons why they're implementing it, and it's actually one of the requirements once you get employed with an associate in many hospitals at the moment. So we're going to look at a few research here. So since 1964, the NN, which is the American Nurses Association, advocated that all registered nurses should be required to have a BSN based on the belief that nursing has become more complex due to technology and organizational change and does require a higher level of education, which I'm not going to argue with. This is the truth. If you talk to nurses who have been at the bedside for a longer period of time, they would agree with the fact that nursing has become more complex. We are getting sick and sicker. We see it in the hospitals. We see it if you've done home care. You can tell that patients are just sick and they're getting more sick than they used to be before. You're getting so many bed-bound patients. It's like the whole hospital is bed-bound. You get what I'm saying? So I remember an old-time nurse or a nurse that has been in the profession for longer saying that, hey, patients used to come and you wouldn't find yourself having to clean this, having to do all these other things, but things are different and you find that you're dealing with a lot of more complex issues, dealing with a lot of secondary issues when it comes to patient care nowadays. So we have that. And also we have this research by the Institute of Medicine, and that's as of 2011, they recommended that 80% of RNs attain a bachelor's degree by 2020. So there's all this scientific research that has been backed up, and so the state looks into it. Certain states actually mandate that, yes, they do want nurses who have their associates to go back and get their BSN, which I don't totally disagree with this. I think that the more education you have, the better you to take care of this complex issues. And we're approaching them based on evidence-based practice, and we're approaching our patients being informed on how to deal with these complexities that we see. So I just wanted to add that. And hey, I do see a question from the last video. International students, I've not forgotten about you. We just might be thinking about the same thing. So just stay tuned to the channel, and more information about different aspects of nursing will be approached eventually. Thanks for watching, and I look forward to hearing from you.